Yeah, I started with CPRIT almost 12 years ago, I guess. I was their IP counsel. And I'll talk about our due diligence process, the IP due diligence process. But I kind of got drafted into this position. So today I'm going to focus more on the business development, the grants that CPRIT gives out to companies as opposed to the research and the prevention side of it. I'll give a little bit of a talk about what CPRIT does in totality, but I'd like to focus on today our product development portion of CPRIT. So CPRIT's mission. So CPRIT back in 2009, the voters approved a constitutional amendment, and it was re-upped in 2000, I think, 17, 18, 10 years from it. So CPRIT gets $3 billion every 10 years to distribute to different grants, and comes in three flavors. One is the prevention group. Prevention is only allowed to be 9% of the total budget. Then there's research, which is primarily with academic institutions, and they have a lot of different grants. Bring young scientists in, older scientists in, money available to go to different institutions. And then finally, there's product development. And so the idea behind CPRIT was to really infuse money into Texas because, as you well know, we're on one of the coasts that are normally associated with biotechnology, and the other coast is east, and down in the south, they think they have a coast too. And so over the years, Texas has tried to promote the biotechnology, and it really has, especially in the Houston area, but also in Dallas and also in Austin now. There's a lot more going on in terms of investment, in terms of companies. But the CPRIT, as you can read, CPRIT's mission is not just true, like I said, to give grants, but we wanted to build the infrastructure as well. Not only physical infrastructure, CPRIT doesn't invest in physical infrastructure, but wants companies to come in there, build infrastructure, and as well as having people that can work there, whether it be C-suite people or people that work in the labs. There's a lot of institutions that CPRIT supports along these lines. So here's the grant portfolio. We talked about it a little bit quickly at the beginning here. So out of the $6 billion that CPRIT's been given by the bond funds, $4.05 billion has been dispensed. And you can see the breakdown. The way it kind of works, like I said, with prevention, it only can get 9% of the budget. The budget's $300 million a year, so you can do the math. We don't have a big staff, and so we were able to get most of the money out to grants, not overhead, which is good. Although we've been expanding lately. When I started working with CPRIT, it was probably around 15, 16 people, and then some outside consultants. But now I think we're up to 55, and there's a requisition to get another 10. It's still not a large agency in Texas, but something that has expanded over time. And then academic research makes the bulk of this. So 9% goes to prevention, and then we split, we being academic research and product development, we split about 60-40, 65-35, the rest of the money. So product development has about $75 million a year for awards. And you can read the rest of the data here. So significant accomplishments are listed up here, billions invested. One of the things that's really amazing on the side of the academic research side is they've brought in 344 different professors. And like I said, it goes all the way from young professors to older professors, more mature. And it's unbelievable the number of people that they've staffed and where the people come from too. Universities all over the world come down to MD Anderson now and UT and different places in Texas. It's really kind of an amazing accomplishment. You can see that CPRIT's funded over 370 clinical trials with 65,000 patients. Prevention is a big part of CPRIT, and they've done a lot of things. One of the things that happens sometimes in a state as large as Texas is those academic institutions are primarily in the 3 or 4 major cities, right? So Houston, Dallas, Austin. And you'll see from product development, many of our companies are in those three places. But prevention really is something that everybody in Texas seems to benefit from. Every county, I forget how many, there's hundreds of counties in Texas, and all of them have been affected or at least administered to by the prevention group in its CPRIT. So although it's smaller in terms of budget, its reach is very, 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 very far. And then as CPRIT has given all the awards, it's really kind of amazing the years I've been working with CPRIT, how many different incubators and innovative groups have sprung up, like I said, primarily in Dallas and Houston. But now there is an infrastructure to build and to come to Texas, and you don't have to feel like, well, I'm not going to have anybody do the work for me. I'm not going to be able to recruit C-suite people. This expansion has been amazing, like I said, and most of my life was spent outside of Texas. I went to Texas to get my PhD and my law degree, but I've been a lot of other places. But Houston's kind of an amazing incubator. This is a slide about the number of approved drugs, and just kind of, you guys all know this, how long it takes and how many different compounds you have to have, the trials you have to do to ultimately get a product approved. So this is the CPRIT development. I'll talk about really what I do now, is the CPRIT Product Development Research Program. So we've got 96 grants out, 852 million. So 78 companies. And I went through it the other day, and almost every company is still in existence in some way, shape, or form, even those from like 2010, I think were some of the earliest grants. And in certain cases, the assets have been sold or the company has been absorbed or merged, but they're still basically, the asset is still alive in most of these cases. 25 companies recruited to Texas. That's kind of why we're here today. It's not just Texas companies, and I'll kind of go through what you need to do to become what we consider a Texas company. There's more than 7.7 billion follow-on in funding from the companies that we've funded. 69 clinical trials, 2,000 patients, 1,500 employees. That's another big part of the infrastructure too, is we like to see that these companies are employing people. That also goes back to the state of Texas and taxes. And then the Texas biotechnology ecosystem has grown nearly 40% since 2010. These are some of the companies, and as you can see, the majority of them, half of them, or more than half of them, are in Houston. Dallas is also a big player, as well as Austin, and then lesser in Lubbock and San Antonio and College Station. So let's talk about the process, which I assume everybody's kind of interested in. We just finished in November, actually, awarding, this time it was 9 companies, $67 million. What I've done recently is that I hold back about, I negotiate with the companies a little bit to get the budgets down slightly, usually about 10%, 8 to 12%. And then what we use that money for is later on with some of the companies, we just started something called a supplemental award. And so for companies that we have at CPRIT that are currently being funded and getting money, it's almost like a bridge, or if they've done really well, we want to encourage companies to go fast if we can. On the therapeutic side, it takes time. So we've added, as you'll see, we've added devices diagnostics, manufacturing, different things that have a little bit less cycle time. And so we want to reward those companies that actually are doing well with goals and objectives with a little more money. Last time we capped it at about $3 million. This time it's going to be capped at $2 million because I think I only have about $8 million left from the $75 million. So what we have is what we'll do we'll post the RFAs in April. That's what we did last year, and that seemed to work out fairly well. And so we have 4 different RFAs. The first one is the Texas Seed Company, and that is basically for really kind of very, very early stage. CPRIT's mission in many ways is to fund early stage companies, not later stage companies. And by CE, I mean early, right? And most of our companies really are we do have some, phase 1, phase 1B clinical trials, but most of them are in that phase or prior to that. So the seed company basically is one that's just getting started, and we cap the award at $3 million. Now, if you're in that category, you can apply for anything like therapeutic, manufacturing, if you have AI, device, diagnostic, anything that's cancer related. I think that's an important point to make here is that, CPRIT, when CPRIT started out, when I first started working with them, almost every application was a therapeutic application. And by therapeutic, I mean it actually treated the cancer directly. And so, again, that's a long cycle time, a long time to get through FDA. And really, it's kind of funny that we used to work, all our peer reviewers are outside the state of Texas. And so many times when I'd be working with the peer reviewers and stuff, they'd be like, well, CPRIT doesn't do this. CPRIT doesn't do that. And you're thinking, well, we're CPRIT, and we do those kind of things. And they're so protective of Texas money. I find that ironic. It's always like, well, I don't think that the Texas people would approve of giving money to do manufacturing. And you're like, well, thank you for being concerned, but that's something that we are trying to develop. And so over time, like I said, the seeds basically can be really anything related to cancer that you can think of. We even have companies basically that if a cancer treatment causes a particular condition, maybe a respiratory condition or something along those lines, that's included in here too. So if you're cancer adjacent is kind of like the term we use, don't think that CPRIT won't fund it, because we do a lot of that now. And so, again, we're just trying to broaden our portfolio outside therapeutics. Therapeutics still end up being about 50% at least of the applications that we get in. So we're trying to develop other areas that are just as important to patients, because at the end of the day, we're really looking to make patients' lives better. And so if it's cancer adjacent and that helps people, well, CPRIT's okay with that. So then the other three, like I said, the seeds are capped at $3 million. The other three are kind of what I've already talked about already. Primarily therapeutics, but adjacent therapeutics, device and diagnostics. We have a lot of companies now in device and diagnostics. Maybe a little bit AI in their diagnostics, and then finally new technologies. And new technologies, in many ways, is kind of a catch-all. If it doesn't fall in those two categories, then we kind of put it in new technologies. But I do think about manufacturing a lot. Like, we have a company that manufactures CAR T cells. We have companies that manufacture radionuclides for prostate cancer. And so really anything in these categories. And so when you apply to CPRIT, I want you to try and pick the right RFA, but we don't like, oh, those people went into new technologies and really they're a device and diagnostic company and we're gonna not review the application. That's not an issue. Really, we care about what the science is, and hopefully you put it in the right category, and if you don't, we'll help you, we'll put it in the right category for you. When it comes to these applications, the cap, we really don't have a cap. At one point in time, there was a cap of about 20 million. I don't really like to have a cap, just because if there's something that's so spectacular that needs 35 million and it ends up helping a lot of cancer patients, then we're fine with that. The thing is, though, if you're going to ask for 35 million out of 75 million, it better be a really, 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 really good application. You might be in phase 3 or already approved. So we do want to encourage companies to apply and then use their budget, judiciously. I mean, this last time we had 9 companies and it was 65 million, so it's about 7 or 8 million. We did have a couple companies. The largest amount I've ever seen awarded, I think, is about 18 million. But this time we awarded 14, I think, for 1 or 2 companies. So it's not an insignificant amount of money. I know that things have gotten much more expensive. Even preclinical stuff has gotten expensive. And so, I feel bad in the sense that we haven't been able to keep pace. Our budget is set at 300 million. And so that's not going to go up unless we can ask for more in the next appropriation. But at this point in time, we know it doesn't go as far as we used to. So we try and get, the last 2 times I think we've done 8 or 9 companies. And that's the expectation this time around. So it's a multi-stage process, and this we've changed. Years ago with CPRIT, you used to have to fill out a full application. And the full application was quite lengthy, a little bit redundant, but 80 to 120 pages is still kind of a heavy lift to do when you're just applying for a grant. And so what we went to was a preliminary application, and the idea here is to basically do a quick sort of different companies and move them to the next stage. It also helps the companies so that you guys don't have to prepare 100 pages. The way the preliminary application is set up now, like a 2-page summary, and then kind of a slide deck, maybe 16 slides, and then 2 or 3 pages on goals and objectives and budgets. And again, they can be relatively rudimentary. This stage is probably more focused on the science than it is the other important aspects, of which I'll get to in the full application. But the science is kind of the main driver. We have panels. Well, last time we got 164 applications, which is the most we had ever gotten. I think the previous year was 90, and every year we seem to get more and more applications. I'm expecting a couple hundred this time. We're getting to the point where we can only handle so many. The process has gotten, more complicated, and I need more and more reviewers, and so it's difficult to get enough panels together once you get about 150 applications. But we did 164 last time, and I did try to separate some of the panels to just do seeds, because sometimes when you combine seeds with the other RFAs, the expectations kind of rise for the seeds. The expectation for the seeds is relatively low, but I will tell you all that when you apply, you better have some data. That's the biggest thing on the preliminary application that they're looking at. They want to see some data of some sort. And so we go through the preliminary applications, and this time we selected 24 applications out of 164 to go to full application. I will tell you, however, that I thought, I go through all of them, listen through all the panels, and go through their critiques. Probably could have been another 20 we could have moved to full application. It's gotten that competitive now. And so through full application, like I said, we have 24 companies that we move forward to full application. And the full application basically goes back to kind of CPRIT's roots, where you have 80 to 100 pages, 120 pages, great amount of detail, as much detail as you can. And it's just not the science, right? We want to see, your clinical plan. We want to know what regulatory, have you had a pre-IND meeting, have a meeting with the FDA? If you have, we want to know how that came out. Sometimes you can supplement. There's CMC people on our review panels. There's VC people, there's PE people. We cover really the whole spectrum. There's marketing people. You better have an idea of how you're going to make money off this. It's important. Less important to CPRIT, although, as you'll see, we do get remuneration from this. But it's really important to the people that actually review this. So don't just think the science is going to be reviewed. Every aspect of your application is going to be reviewed. And you need to think about that when you put the application together. If you're short, if you have a management team is one of the biggest things that the reviewers look at. And so if you have holes in your management team, that's fine, but you got to use consultants, or at least have an idea to know what you don't know, and to know how to get what you don't know. They're really big on that, to tell you the truth. So you have to be invited, you do the application, and once we get the application in, then that application is reviewed. And what we've done with these panels is the panel usually somewhere between 7 to 9 people. What we've tried to do is customize the panels for each of the companies. So you're not just thrown in with people that have no expertise in what you're doing. Now again, there's a limit to that, right? But we're not going to have someone who's a device and diagnostic guy doing therapeutics, and we're not having a therapeutic person. Whether we can get a small molecule person as opposed to a CAR T person, that's a little more difficult. But we do try and fashion each of our review panels after whatever you're doing. So please believe that you're getting a very good review of your application. So the applications come in, they're reviewed by the panels. The panels actually put together questions. Those questions are sent to the company. Then the company comes in for an interview, virtual interview. They used to actually come into Houston for an interview. I can't even imagine how it was done. But it's a virtual review. It's about 3 hours long. And what the goal is to basically is not for you to go over your proposal. It's really to answer the questions that the peer reviewers have for you. And we spend a lot of times, it usually doesn't take any more than 3. I've had a couple of them go a little bit longer, but that's an opportunity for you to show the panel that you understand what you're doing. And the questions are quite incisive and can be lengthy at times, but we try and keep it to 20 or 30, and then we'll have that full application review. At the end of that full application review, that particular day where you're actually have the Zoom call will decide, a score. The panelists will decide a score, and they'll decide whether to move you on to due diligence. Now, due diligence is important, but really the full application review is the most important. If you get through the full application review, the expectation is that your company will be not necessarily funded, but will be recommended for funding, right? So once you get through all that, and out of the 24 this last time, I think it was 13 or it's 14. 14 got through. And then it goes to due diligence review. And so because we don't have the internal expertise, and because I haven't been allowed to do it because now I'm the Chief Product Development Officer, we do an IP review with using third-party reviewers. And basically they do a fairly detailed due diligence of your technology. Not a full freedom to operate, too difficult to do, but they will go through all the patents that you've either licensed or you own. They'll go through licensing, your license agreements, your agreements with manufacturers, just to make sure that there are no IP glitches, that you're not giving away the farm because you work with some manufacturing company to make your molecule. And then there's what we call an integrity review now. Just because of all the AI and all the situations, we have someone actually go through your full application to make sure that you've actually done the work you say you've done, that the peer-reviewed articles actually exist, and those kind of things. But like I said, unless there's some red flags, you should be recommended for funding. And then finally, what happened for the first time this past year is that in the past years, all the companies that ever got recommended for funding by the review panels actually got funded. This year, that didn't work out. So we had 14 companies that were recommended for funding, and like I said, we could only pick 9 because we had 67 million. So each year has gotten much, much more competitive. And then the rest is kind of internal stuff. We have something called the PIC, and we have something called the Oversight Committee, and that basically is kind of a CPRIT internal process. There's no participation by the applicants. And this kind of summarizes kind of the dates that we did last year, which I think will be similar this coming year. So the expectation is that in April, we'll put up the RFAs, the portal open. And to keep the applications down, the portal was only open for 10 days last year. I can remember times where we'd leave it open for a month. I might even go down to a week, I don't know. It's not that we don't want applications, it's just 164 ended up being, and you can see, requested $1.1 billion, and we have $75 million to give. So trying to wrestle with that. And like I said, some of this stuff I've gone over already, but this gives you kind of the time frame. And this time frame will probably be the same for 2026 as it is for 2025. Contract requirements. This is an important part to know. So all the way, we have to sign a contract with CPRIT. The funding is tranched. That's a really important point. So the expectation is, what rarely happens, is that the grant will be for 3 years. And we have ways to extend the grants in terms of, not making your goals and objectives. But what we do is we tranche the funding. So the first year, if it's, and again, it's based on your budget. So some budgets, right, you spend more money in the first year, some budgets you spend more money in the third year. But whatever the funding is for that particular year, what CPRIT will do is give you 50% of the money up front, if you need the money up front. And then after that, once you make certain goals and objectives, 90% of the money spent, then you can actually ask for the second tranche. And we do that for each successive years. So in many ways to basically protect CPRIT, right? If the project goes, awry, especially if you're doing a clinical trial or something, some companies basically bow out at some point in time, and this protects CPRIT in terms of funding. Company must submit quarterly budgets and annual audits and progress reports. I will tell you, we are trying to kind of modernize more our accounting so that it'd be a little bit more efficient. It is a little bit more stringent and a little bit more particular than money from like NIH or federal government money. I know that kind of hangs some people up from time to time. We do have people in Texas that can help you with the process that have worked with CPRIT for a long time. It's worthwhile probably to work with one of those people, not necessarily recommending it, but some people have gone to that to use these accountants that have worked with CPRIT know what CPRIT needs and wants so that you can get remunerated. Or at least you can basically, if you've been advanced money, then you can basically show that you've used that money. This is probably one of the most important slides being here in San Francisco, because when you apply to CPRIT, you do not have to be a Texas company. You don't actually really have to be a company, right? I would recommend that you are, at least in some kind of form, have set up an LLC or set up some kind of corporation, but you don't. Technically, you don't have to do either. And the idea is that we want to encourage people, if they want to move to Texas, we want to make it as easy as possible. So, but you have to fulfill 4 of these 7 criteria within the first year that you receive CPRIT money. So the day you actually get money, 1 year from that date, you have to fulfill 4 of these 7. And as you can read them, obviously, it's just, all we want is the people to be there in Texas. We want the CEO to be there. We want most of the C-suite, if it can be there. When manufacturing in Texas, clinical trial sites, that's usually pretty easy with MD Anderson and all the things that are there. Research organizations or private institution, you collaborate, usually MD Anderson or UT. The manufacturing sometimes, and I don't know what I'm doing on time, but manufacturing activities in Texas, we know sometimes, and I want to bring this up because this has gotten to be a more critical point in Texas. You're supposed to spend, we want you to spend at least 90% of the money in Texas. And there's a minimum of 40 you're supposed to spend in Texas. Obviously, we want Texas taxpayer money to go in Texas. But this gets to be an issue with CDMOs and certain people that you're using outside of Texas, right? Some of your budget can be heavily weighted, right, for clinical people and stuff like that. And so we try and work with you, but you want to let us know that, in fact, you're using someone outside of Texas so we can sign off on it. And manufacturing can be that way sometimes, too. We know that manufacturing sometimes is very expensive or the timing might not work for a company in Texas. But these 7 criteria are important, and you have to fulfill 4 of 7. You have to do it even 2 years beyond the termination of your contract. Because we have companies, basically, that got bought, we have companies that merge, so there are ramifications to that. We also have a match requirement, right? So for every dollar that you get under $20 million, you have to match it, your company has to match it 50 cents on the dollar. And that's a requirement that cannot be waived. And then once you get above 20 million, which happens sometimes because we have companies that have multiple awards, then it's dollar for dollar, right? And that has to be verified. That can't be in-kind money. It has to be mostly money in the bank. We've done some things like if you have an SBIR or certain other type of grants that you're using for the same project, we may give you credit for that. But by and large, it's money in the bank. And that's it. Thank you.